Welcome everybody. Today I'm joined by Brad Hazzard, New South Wales Health Minister, Dr Kerry Chant, our Chief Health Officer here in New South Wales, and Susan Pearce, the Deputy Secretary of New South Wales Health. Can I begin by extending our heartfelt condolences to those families who have lost a loved one at this time. I want to continue to thank our frontline health service workers, our nurses, our doctors, on the front line day in, day out over the last 2 years, who through this period of time, through this Omicron outbreak, continue to provide the care and support for people right across our state who need it. It's been a difficult time for our state, but our health workers, our paramedics, our doctors, our nurses, our O call operators, our cleaners in our health system, every single person is doing an inspirational and amazing job in keeping people safe during this pandemic. Today, we can announce that in our vaccination hubs, our 40 vaccination hubs across New South Wales, we'll be bringing forward the eligibility for a booster shot from 4 months to 3 months. So that's in our 40 centres across New South Wales. We currently have capacity here for around 250,000 vaccinations every week in our 40 hubs across New South Wales. Today's decision will enable over 3.5 million more people from our state to be able to be eligible for that booster shot. As we are clearly seeing, boosters are key to keeping yourself, your friends and your family safe. Due to the extra capacity that we have in our centres, we are able to make this change today. I understand from the federal government that the eligibility from 4 months to 3 months in GPs and pharmacists will be available from the 31st of January. But if you are eligible now at 3 months since your second dose vaccination, you can make those appointments at our 40 centres right across New South Wales. We have the capacity available. We've seen very clearly through the numbers in ICU that vaccination is key in terms of reducing symptoms and keeping people safe. So can I thank everybody for the sustained efforts that they continue to make. We have today over 50% of those who are eligible for a booster shot have received one. With a 95% vaccination rate, that is incredibly pleasing. It has ensured, compared to the rest of the world, that New South Wales has been able to remain strong during difficult times in this pandemic. The efforts that everyone has made across our state has ensured that we've been safe during this difficult time. There'll be other challenges that come our way as we head through this pandemic, but the key strategy and the key thing that we can all do is continue that sustained effort to go and get vaccinated, to get that booster shot. Today's announcement of moving that period from 4 months to 3 months will allow an additional 3.5 million eligible people across our state to receive that booster shot. So can I encourage everybody over what's been a difficult period of time to continue to make that effort, to make that booking. They're available through our 40 centres across the state. We've seen extraordinary efforts from our nurses in those centres who have worked through the entire vaccination program here in our state over many months, and now through this booster campaign continue to work tirelessly. We've seen those centres be an incredible success, and today's announcement will ensure that more people are eligible to get that booster shot. We've seen very clearly in our health system that boosters have been key in keeping people safe. So can I encourage everybody across our state today who's eligible now from 3 months since your second dose vaccination to make that booking at any one of our centres across the state. As I said, it's very key to ensuring you stay safe during this pandemic, and the Health Minister will make some further comments in relation to the clear evidence that we're seeing in our hospitals, in our ICUs, that vaccination and booster is crucial in reducing symptoms and having less severe cases of the disease. So once again, can I encourage everybody to keep that effort going as we move through this next phase of the pandemic. And we know that we'll move through this phase together. We can see the success here in our state. The numbers so far are incredibly pleasing. We're moving through, so can I thank everybody across our state for the efforts, the sacrifices that everyone has made, not just over the last couple of months, but more particularly over the last 2 years. I appreciate that there is fatigue with this pandemic. This global pandemic has taken the world on, but New South Wales has continued to stand tall. And the reason we've stood tall here in our state has been that high vaccination rate, the efforts, the sacrifices, following the rules that are in place. They're not there for the sake of it. They're there to keep you safe as we move through and make our way through this stage of the pandemic. We are making our way through it, and we will make our way through it. And if we can continue to treat everybody with kindness and respect, particularly our health staff, people right across our state, our friends and family, they are the great values of our state. They are the values that will ensure that as we move through this transitional phase of the pandemic, that we will come out stronger the other side. I'm now going to pass to Dr. Kerry Chan, who will give a public health update, and then Susan Pearce will speak to the changes that we're making today in relation to that amendment and bringing forward that booster eligibility from 4 months to 3 months, and then Minister Hazzard will provide some further health messages.
So there are currently 2,863 COVID cases admitted to hospital, including 217 people in intensive care, 66 of whom require ventilation. There were 32,297 positive test results notified to 8 p.m. last night, including 12,450 positive rapid antigen tests and 19,847 positive PCR tests. Of the 12,450 positive RAT tests, 10,417 of these tests were from the previous 17 days. And in relation to the PCR tests, 19,847 PCR test results were returned from 84,976 PCR results. Sadly, we are announcing the deaths of 32 people with COVID-19, 12 women and 20 men. Can I pass my condolences to the loved ones for their loss? 3 people were aged in their 40s, 3 people were aged in their 60s, 8 people were in their 70s, 11 people were in their 80s, 7 people were in their 90s. Of the 32 people who died, 23 had received at least 2 doses of COVID vaccine, 1 person had received 1 dose, and 8 were not vaccinated. 5 of that 32 had received a booster dose. So I think, can I just echo what I know my colleague Ms. Susan Pearce is going to be saying is it's incredibly important that people come forward for their booster doses. Please get boosted now. I also urge people that have got children going back to schools to think about you and your extended family, ensuring that you're boosted ahead of the school year, and also that any elderly relatives are assisted in getting their booster. I can't stress enough the urgency. We know that booster will increase your level of protection, and it is critical that we get that as soon as possible. In terms of the deaths, we have had some requests for more information around the deaths to better understand the underlying health conditions. And rather than reporting that every day, because of the issues of confidentiality, what we're going to be doing is regularly reporting the deaths and providing a little bit more information about the types of conditions that individuals have to better inform the community of the risks associated with those. But in short, we know clearly that people that are over the age of 65, people that have chronic conditions affecting their heart, lungs, kidneys, liver, and those with an immune suppressive condition, so things that suppress your ability to fight infection. So that would be, for instance, if you had a transplant and were on drugs to suppress your immune system. We know those individuals are going to be at increased risk, and that's why for many of those individuals, particularly those with the suppressed immune system, we have recommendations for 3 doses as part of the primary course, and then subsequent boosting recommendations. So please recognise your risks, get boosted as quickly as possible, and get those children vaccinated, but also it's an opportunity for the broader family and extended family to check that they're up to date with their vaccinations. Thank you.
Good morning. We're very pleased once again across the New South Wales Health vaccination clinics to be able to step up to the challenge of increasing the number of boosters across our state. The 3-month interval was due to commence on the 31st of January. We're very pleased to be able to bring that forward to make automatically millions of people are now eligible to come and get that booster dose. So far across our clinics in New South Wales, we've given around 450,000 boosters. As I said yesterday, we have the capacity to do a lot more. It's awful for us to see our bookings in our clinics go begging. We'd really like to see all of those bookings absolutely full. There are bookings available today. There are bookings available tomorrow in many of our clinics. We have plenty of supply of vaccine for the booster doses, so there are no issues for us with respect to supply, and we're really very happy to be able to do this. As the Premier said, 50%, over 50% now of the eligible people in New South Wales have had their booster, which is a great uptake, but we know that given the very high vaccination rates in this state, we can do a lot more than that. It's also really great to see the 5 to 11-year-olds coming out for their vaccines. Yesterday was our biggest day of the 5 to 11-year-olds, with around 4,700 kids in that age group vaccinated in the New South Wales Health clinics. We again will be making sure that those vaccine appointments are available for the kids, so the increase in the booster availability in our clinics will not push out those appointments for the children. The appointments are there specifically for kids across our clinics. I'm really looking forward to those numbers going up. We watch them obviously very carefully. Last year during the Delta outbreak, we watched them like hawks every day, and we got used to seeing a very high number of vaccines being given in this state every day. I'd really love to see that happen again now as we work our way through this latest challenge. Thank you.
Good morning, everybody. First of all, I'd just like to also extend my condolences, sympathy to each of the families of those 32 people who passed away in the last 24 hours as a result of this pandemic. And as the Premier has said on many occasions, let's never forget that each of these numbers are people with families, friends, and to all of them, their families, their friends, our deepest sympathy. It's certainly what motivates us every day as the health team, to keep working to try and get through in a positive way this pandemic that's challenging the whole of the world. But what we do know is that wherever you are vulnerable to this virus. And I want to emphasise that point, that you may think that because you're in a particular area, you're not as vulnerable. Well, I just want to stress that out of these 32 deaths today, these 32 people who passed away, 11 of those people were from southwestern Sydney, 9 were from Sydney's southeastern areas, 4 were from the northern parts of Sydney, 2 were from generally the western Sydney area, 2 were from the Illawarra, Shoalhaven region, 1 was from the inner west, 1 was from the northern beaches, 1 was from the central coast, and 1 was from the New England region. So no matter where you are in New South Wales, indeed Australia, you are vulnerable to this Omicron virus, as well as in smaller numbers now the Delta virus. So what is important then is, no matter where you are, to understand that you are not sheltered from this virus unless you have the shelter of both the social distancing issues that Kerry Chant, Dr. Chant, has ensured that we're all very aware of, so wearing masks, being seated in hospitality areas where possible, also this is advisory and or mixture of advisory and health orders, and of course making sure that you just keep your distance. That 1.5 metres still works very well, and of course at the moment still, while it's very prevalent, working from home where possible and practicable. At the moment, we have 217 people in intensive care units across New South Wales, and we have 92 of that 217, so almost 50%, are unvaccinated. That's the message. There is, in addition to those measures that the government and Dr. Chance and the entire health team have either made into or given as health orders or as advisories, there's one simple, solitary, really important message: get vaccinated. If you think about it, about 95% of the community have had vaccinations. We're still working on the boosters. We want to see the boosters numbers increase as dramatically and as quickly as possible, and hence the reason why we're moving to 3 months phase today, or as of the 21st of January, but announcing it today. But if you have 95% of the population who are vaccinated and 5% who are not, and yet you've got almost half of the unvaccinated sitting in intensive care units, that's a very clear message: get vaccinated. If you get vaccinated, and preferably get the booster as soon as you are eligible, and there'll be many more people eligible as of today, you will be far safer. You'll be amongst the safest people in the world. New South Wales has done all we can to strike that balance, giving us our lives back as we all want them to be, and looking around, many people are actually having more of their old lives back, and certainly I think that's a positive. But we also have to do it safely. So get vaccinated, get boosted, and as of 21st of January, all those extra people will be eligible as a result of the decision of the New South Wales Government to bring the booster program forward to 3 months. Thank you.
Premier, right now you've got nurses protesting outside of Westmead Hospital. They're saying they're being forced to work excessive amounts of overtime because of the staff shortages and hospital system closing. Do you agree? Is the hospital system closing?
Look, there's no doubt the health system here in New South Wales and around the world is under pressure. And our health teams, as I've said, are doing an amazing job, an inspirational job day in, day out. There is clearly many people who are fatigued over this pandemic, which is now stretched over 2 years. But day in, day out, they are on the front line providing the essential care and love to people who are unwell. And whether that's in our hospitals and in our ICUs, I want to continue to thank them for the work that they do. And they are doing an amazing job. There's no doubt that in a pandemic there'll be pressure on the health system. We continue to release that modelling every Friday and how we're tracking on that modelling. As we saw last week, there's no doubt that we are tracking better than our best case scenario, and that's reassuring and that's pleasing. Having said that, on the other side, there are pressures on our health staff. With the furloughing of health workers here in New South Wales, that's put extra pressure on the system. Extra challenges come with that, but there are also reassuring signs. As we make our way through this pandemic, we will get through it, and the heroes on the front line are our health workers, and they've been inspirational during this pandemic, during the last 2 years, during this recent outbreak. When I've visited many hospitals during this period of time and spoken to our health workers and listened to their concerns and thanked them for the continued work, on behalf of the people of our state, can I just continue to say, you are the heroes of this pandemic, day in, day out, working tirelessly to look after our loved ones across New South Wales. In relation to the specifics of their concerns, I might get them to the
Thanks, Brady. Look, obviously our nurses and midwives, but particularly many of the midwives are now doing nursing as well in a broader sense for patients in other parts of the hospital. And over the period of the last 2 years, there's no question, all of the health staff, not just nurses, the doctors, everybody, has been under enormous pressure, and I want to thank them for that, for doing the work that they're doing. And our intensive care staff have been at the front line, doing an incredible job. And on behalf of the community, the broader community of New South Wales, I think we all owe them a massive thanks. As to the actual staffing numbers, since this government came into government, we have employed another nearly 10,000 nurses, and in the current 4-year period, we're employing another 5,000 nurses. It's a $2.8 million boost, and that certainly is aimed at trying to relieve the pressure on our frontline nursing staff. The government's actually put in $2.8 billion, so funding from taxpayers of nearly another $3 billion just in this current period to employ another 5,000 nurses over this current 4-year period. So the government is doing everything it can. Having said that, I have been, as Health Minister, meeting with the Nurses and Midwives Association, the Union for Nurses and Midwives, and I have been listening to their concerns, and we are certainly considering some of the operational challenges they have inside intensive care units, and certainly they have been compounded by the pandemic. But all I can really say at this point is the government is doing everything it possibly can to address these concerns. And again, thank you. I'll add one final comment. Obviously, as Deputy Secretary Pearce has said many times, our hospital systems operate as a network, so that we have, there might be, for example, an intensive care unit at Westmead that's under massive pressure. And you heard the figures I announced a little earlier in regard to the number of cases and people who are passing away in various areas. That also reflects the number of cases in those areas. And South Western and Western Sydney have been very challenged. And so you've got to expect that those intensive care units, those hospital beds, are under massive pressure. But again, as Deputy Secretary Pearce has made the point, we operate as a network. The entire health system is a network. That's the way it works right across Australia. And we move patients as is required. We've talked about that in many of these press conferences many times. And patients do get moved. I think last week we were talking about patients being moved from Westmead to North Shore, to here actually, where we're doing this press conference today. So all in all, we're doing everything we can, working with the union, working with the nurses and midwives generally, working within the network, putting a lot of, obviously, money into additional nurses, and we'll continue to do that, and we're very much committed to employing those additional 5,000 nurses, many of whom have already been employed, but more to go in this current 4-year period.
Premier, what we just said there is, what the Minister just said, Premier, is there any consideration to looking at a surging plan where you call on the private health networks, and if so, is there any incentive payments that are being considered to people?
We've had, look, you heard the Federal Minister yesterday talking about agreements that have actually been in place since March 2020. I remember, I think it was about March 29th that we had the highest number at that period. There was a lot of pressure going on, and in that month all of the states agreed with the federal government that we would negotiate with our private hospitals to have agreements in place. The federal government helped each of the states and territories in regard to funding that kept the private hospitals open, and as a result of that we have those arrangements still in place, and where necessary we can actually move patients into the private sector. What we are doing at the moment in New South Wales is essentially moving patients who are not COVID patients into the private sector, so we do get the benefit of the incredible nurses and doctors who also work, quite often they work in both sectors. They work in the public hospital, they work in the private hospital as well. And so we do have that capacity to network and surge by using those staff.
Just on incentive payments, is there any consideration of paying people that aren't working on the private front line to come across and use their expertise on the front line with work with so much of the workforce?
Look, the current arrangements for payment have been continual through the pandemic, and it's essentially what we're all doing across Australia. So there's no particular call for that at the present time, and it seems to be working quite well at the present time.
Minister, can we
Sorry.
scrap QR
Morning.
codes?
Sorry?
Can we scrap QR codes? What is really the point of us checking into every shop and every cafe when we're having 30,000 cases a day? Is that contact tracing information still important, or could we move to just age things and things like this?
Look, I think the QR codes have served an amazing purpose. As we've gone through this pandemic, there have been different pressures. I can't tell you every day when I meet with our health team, we wonder what's going to be meeting us that day. The QR codes have worked really, really well at various stages of the pandemic, but they are still working to a degree in certain circumstances. I know I was at, I think, Woolworths on Sunday, and I got a message saying I had to look out for symptoms because of the fact that there's been someone positive in that environment. It still helps us to individually to take personal responsibility for ourselves. So there are arguments, I think, that go both ways at the moment, like everything else in health. But constantly under discussion is what I would say. I'm not rushing towards arguing to completely get rid of them, but I do think that they perhaps have a higher priority in the areas that you're talking about. So the vulnerable facilities, aged care facilities, hospitals and so on. But they still serve a purpose as long as we are actually looking at a history in our Service New South Wales, which, because I've been well trained by Minister Dominello to do that, was never really keen to do it, but I do now. I do see that, okay, I have to be very careful because I happen to be there. So hopefully you're doing that too. I'm sorry, I just can't hear you with that.
Sorry, Dr. Chan flagged there'd be a change to the way that deaths are reported.
Yeah.
Does that mean that we won't be getting deaths daily? Is it that?
No, what she was explaining, and this is, I emphasise this was a recommendation from Dr. Chant and the broader public health team. The death, the very sad duty that we have each day is to tell the community how many people have passed away, amongst other things, that we do each day, and that will still continue. But what she was explaining to the Premier and I and the rest of the relevant parts of the government is that to be able to give a really clear understanding of what is actually contributing to that death, they need to have some time, some considerable time. If somebody's passed away in a hospital, say in Western Sydney, that information has to be aggregated or collected by the doctors to work out, was it actually caused by COVID? Was it a contributing factor? What other factors were in play? And we've talked about that, I think, yesterday and the day before, but Health's recommendation is to now move to that. If you like, I can get Dr. Chant to expand on that, or do you, is that enough? Okay, I'll ask Dr. Chant to expand on that.
So I think that the key point is the thirst for information in some sections of the community, and to do that justice, because obviously in a 24-hour cycle where we might be aware of a couple of patients that have underlying health conditions, that doesn't actually give people a sense of those conditions. But obviously we don't want to identify people, we don't want to disclose personally things that may allow worsen the impact on loved ones. So what we think is more useful, and as I've always said, look, a day in data doesn't mean much, but what's important is if we want to give the community the messages, they're clearly interested in knowing the vaccination status, and we will be able to do that, but also to explain what are some of the underlying conditions that are contributing to those poor outcomes and how that relates. So it's really about an effort to give better information to the community, but we can't do that in a 24-hour cycle. So we will still report deaths, we'll still report vaccination status, but we will aggregate and give some more richer data in as timely a way as we can to just give a sense to the community. And that's really important because I think I've said in repeated press conferences this week, whilst I'm really keen that the kids get vaccinated, I really want a sense of urgency around the boosters, particularly those older individuals and people with underlying health conditions. It is really critical that you act with such a sense of urgency, and so I would actually call on friends and loved ones of people in those situations to really do everything you can to support them to get access. It's really pleasing to see our clinics opened up, but I really want a sense of urgency. We know that third dose takes 7 to 14 days, and so that is the best protection we can give, is having that third dose.
So, how worried are you though? How worried are you that when school goes back, you're going to have a whole lot of people exposed? Because obviously when children are going back, a lot of them aren't vaccinated, they're seeing their grandparents. We're due to be sort of, kind of coming out of the peak at that point. Are you worried about another surge being fueled by schools return?
I think the numbers will go up and down, and we know that when there's mixing and introductions of new social networks, but we can also counter that through our own actions. So we are currently working with government on the return to school plan. Yes, when schools go back, there are more connections of different social networks and an increase in cases would be expected. But we as a community can take other actions to offset that. But one of the keys is getting boosted. We believe that by getting boosted, lifting that immunity, it will provide protection, but it will also reduce individuals' risk of catching the disease. So again, it will have some transmission protection, and so we would want to get as many people vaccinated next week and then the week after. as quickly as possible, and I'm really pleased that we've got that extra capacity and spare capacity that we can use. And I just want to thank the community for coming forward. And can I also just express my gratitude to the pharmacists and GPs? They have been working really very hard as well in order to roll out and provide much access. And I've also asked the community to be understanding if the GP is prioritising someone in a higher risk group than someone else, because we do need to get those most at-risk people vaccinated and boosted first.
So, is there a directive at the moment on how long someone should wait after getting COVID before getting boosted?
Okay. So ATAGI is ATAGI, which is the Australian Technical Advisory Group on Immunisation, which reports and provides the advice. And they're basically the experts that give us the guidance, and we link to that. They're currently working through these issues, but in essence, what we would generally say is if you're recovered, and generally in the 4 to 6 weeks after you've had COVID, then proceed with your schedule. But ATAGI's currently got this under consideration. Having been exposed to COVID will actually boost your immune system. But clearly we want to make sure that people are availing themselves of the additional protection from boosters.
By having a lot of people being boosted now, do we risk finding ourselves in a similar situation to, say, December, as we go into winter with lots of people having waning immunity and potentially, a bad winter wave of Omicron or the next variant coming through?
I think the future is difficult to predict, but I think those scenarios of an upswing in cases prior to winter is something that we have to plan and talk to the community about. We will then, ATAGI will consider its advice, and I've sort of flagged that obviously we're watching the experience in Israel closely, where they're actually doing their 4th booster for those that are immunocompromised. I've also said that we will need to be aware that we will see upswings in cases, and we are going to have to adjust our settings, adjust our behaviour. But 2022 is going to be a time where we've got those fantastic tools of effective vaccines. We'll have some antiviral therapies additionally coming. We've got some therapies now, but we will be able to use all of those tools as well as those individual behaviours. And we will also have a very strong focus on the vulnerable, who will continue to potentially need to take special action. So, they will have to be more diligent about choosing outdoor environments. They'll have to be more diligent about wearing masks themselves and adapting as we go through 2022.
Premier, we've been told that critical workers who are COVID positive are being forced back to work in New South Wales. Firstly, what's your message to the employers that are doing that, and what are the rules in New South Wales about COVID?
Well, if you're COVID positive, you aren't made to isolate. That is the rule. Now, obviously, for critical workers, through the National Cabinet process, we've made exemptions for close contacts, and they are in place. And we've seen, obviously, the challenges to the distribution networks, health system, and obviously we'll work through our education plan, which we'll announce later in the week. But the rules are clear in relation to if you have tested positive for COVID-19, and that is that you need to isolate for 7 days. We have made that in line with the National Cabinet's response. That's important in reducing transmission. And my clear message to employers is you should not be forcing people to come to work in circumstances where they are positive for COVID-19.
Premier, pharmacists are overwhelmed.
Do you agree with the Education Standards Authority threatening media outlets with big fines publishing HSC lead tables? And why shouldn't that information be made available to public parents?
Well, my understanding from what I read this morning was that NESA has said they have not been doing that. So I don't think there should be anyone threatening with fines. Obviously, I believe in greater transparency. I think the more transparency you have in a system like that, the more informed decisions people can make. I think it's always useful for educators and for members of the public and mums and dads and teachers to understand educational outcomes Having said that, there's a balance with that, because I think sometimes information that can be provided does not actually lead to the analysis that comes off the back of it. And I think you've got to be very careful when you are releasing information. There's a whole range of figures in relation to educational outcomes that need to be considered. It's not a black and white issue. So I can understand why in a number of cases certain information might not be provided, because it may lead to reducing confidence in a system when it doesn't need, when there's no need for that confidence to be lost. But having said that, I will always, as Premier, I always believe that we should err on the side of transparency. Transparency in providing information is crucial, and I think particularly, as we're going through COVID, the decision we made in releasing the modelling for hospitalisations and where we're tracking is important, because providing information to the public instills confidence in whatever area of public service.
Just in terms of staffing, so I understand the federal government yesterday announced the emergency notice that we've seen private sector staff enter the public sector to help with hospitals. The state government, I think, announced similar measures in August.
Yeah.
Will that announcement by the federal government make any difference here?
Well, the advice I've received is not really, because we've already obviously working with the private health system with the announcement that we made a couple of weeks ago, as you correctly asked. So we'll work through the details of that, but we're already operating as other states are and working very closely with the private health system in providing care for patients during COVID. So look, I'll continue to take advice on that, but my understanding is not. No.
Premier,
Premier, give it this on the
say
phone.
they're dealing with hundreds of calls a day from people who are looking for rats. A lot of those calls from vulnerable people who are pregnant with cancer, people who have a disability. Is the state government looking at an expanded program to give vulnerable people priority access to rapid antigen tests?
Well, the main thing we're focused on now is supplementing the Commonwealth's acquisition of rapid antigen tests. What we've said, like other state jurisdictions around the country, is that we want to acquire those tests to support government service delivery, and also for those people who are vulnerable in our community and in our care. Now, whether that we've already been providing rapid antigen tests to remote and regional Aboriginal communities. We will obviously be providing those rapid antigen tests for our health workers who are on the front line during this difficult time. We have said that we're working through our return to school plan, and we see as part of that return to school plan rapid antigen tests playing a role there, which we intend on taking to National Cabinet tomorrow. I understand that there are challenges in the acquisition of rapid antigen tests for members of the public as we wait for those private supply chains to come on board. When I'm looking at the testing numbers each day, what's also pleasing is that there is a balance now occurring between the rapid antigen tests and the PCR tests. So if you aren't able to access a rapid antigen test at this time, we still have those free clinics set up across the state for PCR tests that don't have pressure on the queue, those queues that we saw over the Christmas New Year period. So what I would say to people today is, if you do have access to a rapid antigen test, please use that, and if you do not, continue to use one of those PCR tests which are available free. What's pleasing as well is those queues have subsided. We're also getting the turnaround time on those PCR tests a lot faster. So that's pleasing and reassuring as well, because that gets information back to people as quickly as we can.
You've been willing to acknowledge repeatedly through the last few weeks that the hospital system is under immense pressure. But will you admit that what that actually means is that patient care is suffering across the board because resources are so stretched?
Well, what we're seeing in our hospital system, not just here in New South Wales but around the country and around the world, is substantial pressure on that system. We made the decision, like other states, for the Eastern Seaboard states, to defer non-urgent elective surgery. We also made those changes during the Delta and Alpha outbreaks. Now, we know that provides significant inconvenience for many people, but that's the approach we've taken in the past to alleviate some of that pressure. And as we come through this period of time, that pressure will ease. At a height of an outbreak, whether it was the Alpha, Delta, and now Omicron, there is always going to be increased pressure on our health system. Challenge this time as well is there's increased pressure on our staff because of the furloughed workforce, and that's been an additional challenge that we haven't seen on the past two. But we are working through it. as a people, we're working through it, and we will get through it. And our country has stood tall during this pandemic, and just like those around the world. But we're in a much better position today in Australia because of our high vaccination rates. And the change we've made to booster shots today, as Dr. Chant has said, should provide confidence that with a highly vaccinated population, there will naturally be less pressure on our health system than other areas or other health systems around the world, because our people have made that enormous effort. And today's announcement is really a call to arms, literally, for people to go out and get that booster shot. It's been 3 months since your second dose vaccination. You can now get that booster shot at one of our centres. So please make that appointment, because the efforts that everyone has made today, that's been the key factor in putting downward pressure on the hospital system.
On businesses, it's been a couple of months now since the Omicron wave first appeared. Are you satisfied with both the speed and the amount of support available for businesses? Is there anything the federal government could be doing to help out here?
We'll always ask for support from the federal government when it comes to assistance. But look, as the former Treasurer, I mean, I know going through the last 2 years, when you move through these different waves, there's always a call for assistance, and we have always, as a government, prioritise support for businesses and our workers before the budget. And we've been able to do that more than any other jurisdiction in the country because of the strong financial position New South Wales was in going into this pandemic. What's important, though, when you're going through this phase is that you consult widely, you work with business groups, you work with those organisations, and make sure, as a government, that financial investment from the state makes a difference. Now, one side's the financial investment, one side's the amending regulations and making it easier for businesses. That was a key factor last year, and I can tell you from the feedback as a former Treasurer that for a lot of businesses, the support in terms of reducing regulations and red tape for businesses made a real difference. Now, I noted this morning the Treasurer was out speaking to this and some of the changes that he's looking at, and the government will work through. But I can assure businesses across the state, just like the last 2 years, we've got your back as we move through this transitional phase. There's no doubt we're now seeing what learning to live alongside the virus is like. We've been talking about it as a cliche, but as we move through with a highly vaccinated population, it's going to create challenges, which we're seeing, but our efforts in getting through this period of time will ensure that we do, just like we did for the last 2 years. But I always think when it comes to providing that support, best to consult, target that support to where it's needed and where it will make a difference. That's what we did over the last 2 years, and I know as we move through that period, there's always the questions that come through, Omicron started or Delta started, but best thing for governments to do is assess the situation, ensure that the investments are made are evidence-based. We've done that over the last 2 years, and my advice to the Treasurer has been work through that process first, understand where the need is, and then we make the policies off the back of it, rather than jumping over and making decisions that then you get to a situation where the investment you make doesn't have the impact, and ultimately as well, these are taxpayer dollars that need to be spent wisely in areas that will make an impact. And I think if you look at the last period of time, every outbreak during this pandemic, our economy has rebounded strongly, and we've kept people in work. And that's what we're focused on as a government is keeping people safe, getting people boosted, keeping society open, and keeping people in work so they can provide for their families. And that's the balance that we've had over the last 2 years, and that's what we'll continue to do as we move through this transitionary phase and into whatever next challenge this pandemic throws at us.
Thanks, everybody. Will you push the TGA to approve more RATs made by Australian companies to help guarantee supply? And on that note, do you have any comment on the 42,000 rapid antigen tests which were stolen from the warehouse in Mascot overnight?
Well, yeah, the police will catch you, and the police will catch you, and at a time when everyone across our state has made incredible efforts in keeping people safe, in making sacrifices, what a disgraceful act, and the police will catch you.
What about the TGA?
So the TGA, well, this has been one of the issues. I mean, there's obviously a shortage, as we know, of rapid antigen tests, but let's not forget, in 2 states around the country, up until the last couple of weeks, rapid antigen tests were illegal in those states. Now, as soon as we were able, here in New South Wales, to procure substantial amounts of rapid antigen tests, we went out and made those purchase orders. And what you'll see in New South Wales is, from a government's perspective, outside our responsibilities, we have made the decision to go and procure more than any other government across the country, because we think and we believe that those tests will be important to keep our frontline service going. But ultimately, you can't procure tests that are not approved. So we obviously rely on the advice from the TGA. That provides greater restrictions for governments or for chemists and supermarkets to purchase tests. But ultimately as well, from the you would assume from the TGA's perspective, there's no point procuring a rapid antigen test if it doesn't actually work. So we'll work through those issues with the TGA, but ultimately what we've done as a state government is gone ahead, purchase ones that are approved, and will make a difference and help people keep people safe.
Does that mean, Premier, that you believe that, that as a nation we've been slow to embrace this new technology? We've obviously been reliant on PCR tests for so long.
Well, PCR testing has been incredibly successful here in our state, incredibly successful. And the testing rates in Australia are world leading. And I think that has been crucial in terms of ensuring we've kept people safe. The efforts that people make, particularly over the summer break, where those queues were incredibly long, the patience of our people and the sustained effort on testing has ensured we've had downward pressure on our hospital system. And that's why if you look at the facts, and when we're through this pandemic and we all take a step back, and I know we can be critical and disappointed and anxious during a pandemic, but we step back and look at the success in Australia compared to anywhere in the world, I think we've been truly blessed, and that's been on the back of the efforts that people have made. And when it comes to rapid antigen tests, the TGA approved in sometime in November those tests as we moved through, and I know even post that point in time that they were illegal in a number of states. So there has been a transition from PCRs to RATs. I think that's going to be a natural aspect of living alongside the virus as we move through. As I said, I believe that 2022 looks like families across the state having rapid antigen tests in their medicine cupboard. I think that's going to be part of life as we move through. But from our state's perspective, what we want to do is make sure those people who are vulnerable get access to those tests, and we will use those tests that we have purchased to keep those government services as we move through 2022 functioning as seamlessly as possible.
Thanks, everybody.
Thanks, everyone.
Thank you.